Demi Moore was so stressed, she says she lost her front teeth. Is that even possible that stress can do that? We're going to find out. She was on The Tonight Show on Monday, and she told Jimmy Fallon how she lost her two front teeth. She said, quote, "I sheared off my front teeth. I'd love to say it was skateboarding or something really kind of cool, but I think it's something that's important to share because I think it's literally, probably after heart disease, one of the biggest killers in America, which is stress." Demi Moore's 54 now. I would never guess that. Looking great. She says, stress sheared off my front teeth. But she, of course, went to the dental experts. Modern dentistry, as she said. Thank God for modern dentistry, because they got her all cleared up and made her look wonderful again. Now she can go out on those red carpets and smile and look gorgeous. But is stress really the cause for losing front teeth? Is that a real thing? The boys on the team, Ben and Mark, they're talking. They're like, I have dreams of losing my teeth all the time. I've never had those dreams. Is there really such thing as stress leading to you losing your front teeth? We're going to find out. Joining us now on the night side is Anaida Deddy, who is a dental hygienist. She's also a trainer for the Ontario Dental Hygiene Association. Anaida, how are you tonight?
Good, thank you. How are you?
Good. So specific to the wonderful and talented Demi Moore, is it possible to lose teeth because of stress?
Stress affects overall health, right? And the mouth is no different from our health. So definitely stress can affect the oral health in different ways. So definitely it can affect probably like from gum disease to grinding, canker sores, and different things like infections in the mouth. So definitely I would say that stress does affect the oral health.
So would it be fair to say that you're not going to wake up one night or in the middle of the night and have teeth that have fallen out? You're probably going to see some signs inside your mouth before it gets to that point?
Of course. This doesn't happen overnight, so definitely I don't want people to get scared. This definitely will give people some signs and symptoms before, and that's why you can't ignore. If you have some signs in the mouth that you see that is not normal, you definitely have to look into it and go and see the dental professional.
All right, so give us an example quickly. Anaida Deddy is with us. Give us some examples of what those signs would be in your mouth. Like what would be something if you're looking in the mirror, you'd go, oh, I better get there to the dentist.
If you have bleeding gums, or if you wake up in the morning and you have a sore jaw, definitely that's a big sign of it, because it's probably you were grinding during the night. Or if you see any canker sores and they are repeatedly that you see them in the mouth or around the lip area, that's definitely you can't ignore all of those signs that you see.
And are those signs specific to only stress, or could they give an indication of other things as well?
It definitely can give indications of other things as well, but most of the time the grinding is one of the, I think, probably top signs of stress.
So from a dental perspective, when it comes to stress, if you went into your dentist then, what sort of advice would they give you in dealing with stress? Would it be the same as if you went to see a doctor, or is there a dental version of dealing with stress?
There is also a dental version. So if we see that the person is telling us, oh, I wake up in the morning and I have a sore jaw, and we know that the problem is that the patient is probably grinding or clenching during the nighttime, and we will consider and we'll have them have a night guard, which they will wear during the night, and then they will protect the teeth. So definitely that's a very important part of it.
Very cool. Anaida Deddy is with us. She's a registered dental hygienist. If you have any dental questions, the phone lines are now open. 877-518-5151. Anaida will answer any of your questions. 877-518-5151. Of course, you can text them as well. You can text us at 514-800, and you can text at 71010. So when you hear someone who is as famous as Demi Moore, then, Anaida, on The Tonight Show saying that stress made her teeth fall out, obviously that's a little bit misleading in the sense that it's not exactly true, but there is some base in the truth. What would you have rather her have said from a dental perspective?
And you know what is so funny is because when we tell people a lot of things, people sometimes don't listen to you. But because as soon as they heard that Demi Moore has, had this problem, they all become interested about these things. And there's actually, you see this everywhere. And they are so interested because a famous person had this problem. So they will probably pay more attention to the famous person than the dental professional. So I would definitely, I think it's good that she actually said what happened to her, because she made aware people that they should not ignore, like when they are stressed and other signs and symptoms they have. I think it's a great thing that she made everybody aware of what happened to her. So probably other people that have the same problems probably should do something before they have the outcome that she had, that, to lose the teeth completely. So they can do something before and they can save the teeth.
For sure. And she's a great woman to say this, because she's known not only for being beautiful and in great movies, but she has a beautiful smile.
Yes, she does.
So again, as someone saying, hey, I had this problem and I'm known for my beautiful smile, you need to pay attention. It's probably good. So here's what we're going to do. We're going to let Anaida answer any of your dental questions. She's a registered dental hygienist, and she's ready to take your calls. All you have to do is dial 877-518-5151. Here it is again, because we want your dental questions. 877-518-5151. And you can text at 71010 or, of course, 514-800. And we'll get to your calls and your texts straight ahead. I'm John Paul. This is The Night Side. Your dental hygienist is in. It's time for your questions. If you have any dental questions, here's the number for you to call. It is 877-518-5151, 877-518-5151. Registered dental hygienist Anaida Deddy is with us. And Anaida, I'm going to start with a text, because I think a lot of mom and dads ask this question. They say, hey, John, it's always a challenge to brush my 7-year-old's front teeth. What is the best way to deal with that? Is it with a battery-operated toothbrush? Is there a secret inside the dental club on how to brush a 7-year-old's teeth?
So what I usually say is it's a great idea if you give them a toothbrush, and if the mom has a toothbrush, and brush their teeth first with the toothbrush, and then let the child do whatever they want to do after with the toothbrush. So it just does the job, and it makes them happy as well. Also, it's a great idea to have an electric toothbrush. I would definitely suggest that. It's because it's easy to use and is much faster than the manual toothbrush.
All right, I like your idea of getting the kids involved. That's a good one. Let's go to Kyle, 877-518-5151. Kyle, what is your question for Anaida?
Okay, so I have a couple. So the first one is I wake up, or every day basically, or every other day when I wake up or throughout the day, my jaw seems to pop or crack. And I don't know if that's just associated with the way I'm sleeping or grinding my teeth at night. And then the second one is I lost 2 teeth in the very back due to hockey. And I was wondering if if it's better to get implants, or just to put a bridge over the areas where I lost 2 teeth in the back.
Okay, so I'll start with the first question that you had. I definitely would think that you probably clench or grind, and probably because you are a hockey player, or you were at some point, probably you also clench or grind during the day as well. So it would be a great idea probably to see the dental professional and to have an impression made and have a night guard done. And probably if you do also clench or grind during the day, probably would be a good idea maybe choose some sugarless gum probably during the day. And not too long, though, because the gum probably will not help your jaw, but just maybe until the sweetness is there, and just throw it out. And probably sometimes it's like grandma's recipes. What we say is just maybe put the tongue in between your teeth, and that's not going to allow you to grind or clench your teeth, and it's going to be actually in the very to-go position. It's the most relaxing position that your mouth will be. And the second one, the first option will definitely be an implant. The problem is there is so many things. It's probably, I'm not sure when you lost those teeth, like how long ago was that, because it might not be much bone support there. So probably you have to get checked for that. And if you don't have enough bone support, you probably will need to do a surgery. It's called bone grafting, and then have the implant in. Bridge, I'm not usually a big fan, is because you will have to file down the two adjacent teeth. And if they are healthy, probably it's not a great idea to do that because they are healthy, so you just have to let them the way they are. But if you have big fillings on those teeth, or maybe if you have a crown on those teeth, definitely a bridge will help in that area. But I would definitely suggest that you see the dental professional, and then after the examination of your teeth, I think they would probably give you the right option.
Yeah, because the one tooth I had a root canal done on, and it just where they did the root canal, it just chipped again like a week ago.
And you didn't have a crown on that tooth, right?
No, there was originally a crown on it. Then they popped it off, and then they put a filling, and then it still was pretty bad. So they did a root canal on it, and then they just, they whatever they do, right? So
yeah. So the thing is, when you have a root canal on the tooth is very brittle. There is no blood supply going through that tooth. So it's very, very often that if you don't put a crown on that tooth, it's going to break, and sometimes it cracks in a way that there is no way to actually fix it. So that's why we suggest after a root canal would definitely be a good idea to have a crown on it. If that tooth is adjacent to that missing tooth, probably the great thing for you would be a bridge, so it will help those two teeth, and then the last tooth is going to prevent them from further damage.
All right, thank you, Kyle. Appreciate your call. 877-518-5151 from the text. Annie asks, I have gums that bleed any time of day, and I sometimes wake up in the mornings with blood in my saliva. It's not a lot of blood, but it's been going on for a while. What could this be caused from?
That's definitely he has some kind of gum disease. It might be from gingivitis to periodontitis, and that means it might be only an infection of the gum, but it might be also infection of the bone. So definitely he will have to go to the dental professional as soon as possible, because if that's already periodontitis, that means that if it's infection of the bone, he might lose the teeth. So it's a great idea to go to the dental professional as soon as possible before he loses the teeth. And one thing that I really want to say is that if people see blood coming out of their eye or if other parts, they will run to the doctor. When they see blood coming out of the mouth, they just say, oh, you know what, it's just normal. It's definitely not normal, so they have to go and see a dental professional as soon as possible to make sure they don't lose their teeth.
All right, let's go to Allie, 877-518-5151. Anaida Dedi is with us. Oh, okay, we lost Allie. That's all right. Anaida, a couple other texts.
Sure.
Renee wants to know, is it necessary to buy fancy toothpaste?
No. The most basic toothpaste is fine. It doesn't matter what kind of brand it is. It's going to do the job, and it has to be a very small amount of the toothpaste that is going to be used. So definitely there is no point to buy the most expensive one. It's actually the way you brush. So definitely the most the most common toothpaste is fine.
All right, my text board is blowing up here, Anaida. I wish we had more time because we could do this. But there's a part of me that wishes we had more time, and there's a part of me that's like, I've had enough. My mouth is already sore listening to Kyle's problem. Whew. That's craziness. We appreciate your time. Anaida Dedi, registered dental hygienist. Thank you for joining us tonight on the Night Side and sharing some of your wisdom. Yeah, some good stuff. I wish I could have got to everyone's text. There's a lot of text coming in, overbite texts, flossing questions, being stressed out questions, front teeth questions, sore tooth questions, crown questions. They're coming in. One question that I should have asked her was, are we getting to a place where there's drill-less dentistry? That's a good question. We'll do it again sometime on the Night Side. That was fun.